Many women come to the doctor and complain about symptoms like emptying disorders like feeling of incomplete emptying, constipation, pressure, and even pain. The medical examination modalities contain among others MR defecography, classic defecography, GYN examination, or ultrasound. The most examination methods are performed in non-physiological supine position, which leads to legitimate objections. Anyway, there are many research papers describing the supine position as correct. This controversial discussion still follows. For this reason, we developed a new easy method to perform the measurement by using the transperineal ultrasound. We perform it in supine and then in sitting position. Then we compare the results and see the difference. And this is how it works. First, the patient lies down in the supine position and has to squeeze. This provokes the lifting of the pelvic floor organs and represent the optimal individual pelvic floor conditions for this patient. In this moment, the image of the pelvic floor is created, so that the measurements can be taken for this particular patient in her best possible pelvic floor conditions. The values are then typed in the PC, AKMK Pelvic Floor Calculator. Then the patient sits down on the examination chair, and as next she is asked to press, so that the organ descent can be detected, and image of maximum pelvic floor descent is taken. Now the pathology is most pronounced. Now new measurements are taken. These should be carried out in a certain order, and these values are typed into the AKMK Pelvic Floor Calculator again. Our innovative algorithm-based software shows then the whole extent of the pelvic floor disorders, including the size of rectocele, cystocele, or enterocele. Then the doctor gets objective results and can recommend the correct, strictly individual adapted therapy for this patient. After the following therapy, surgery, gynecology, urology, the patient comes back and doctor performs exactly the same examination. So the result of the procedure and the disease development can objectively be tracked. Any negative development can early be corrected and procedures can be modified. This software offers a useful, reliable, and above all an user-independent tool to diagnose all pelvic floor disorders and really allows to compare the pre- and post-operative results. This is new and a must-have for all pelvic floor units. Why? Because a significantly more accurate diagnostics finally leads to better results. Ask us for more. Visit www.endosono.net